This is Pod Populi, podcast for the people.
Once again, I am back at Crystal Clear Moments. I am your podcast host, Crystal Blackwell. I have a really special guest for you today. Now, I always say my guests are special because they are, but this one I think is really unique because not only from my observation of spending time with her, and we've been touching each other in terms of our circles for the last year. And I've noticed that not only is she beautiful on the outside, you guys, she's gorgeous, but she's beautiful on the inside. And the work that she's doing is also beautiful. So you got a trifecta thing going on, girl, that I think is just amazing. What a gift that you have. So let me give you a bio so you guys can just come up to speed on this wonderful person that I'm gonna introduce to you. Her name is Kris Adair. She's a board-certified family nurse practitioner and a visionary healthcare leader with a deep-rooted passion for hormone health, skin care, and holistic wellness. That is all the things that we need to know about, and it's happening now. I just think that is so powerful. With years of clinical experience, so yes, she knows what she's doing. She blends traditional medical expertise with cutting-edge digital innovation to improve patient outcomes and expand access to care. So not only is she cutting edge with her innovation, and we'll talk about just some of the things that she's doing, she's inclusive, and she wants her care to be affordable. And that was something that you shared with me on just more than one occasion, how that's important to you, that people should have access to good quality care.
Right.
She's a creator of 2 groundbreaking digital health platforms. I can't wait to learn about these. One is Kris AI, which I think is kind of cute, a virtual hormone health assistant. And I think it's Andy. Mm-hmm. Andy, yay. Andy's a digital skincare advisor. We all want that. Right now it's all about the health of your skin. So it's good to have these tools available to us. She thoughtfully developed them to address complex health and wellness concerns through personalized, user-friendly, and tech-forward solutions. Known for her dedication and patient-centered care. Now that I know for just personal, because I know 2 people that are personal friends of mine, and they have 2 different stories, and they both talk to me about working with you in 2 different instances, 2 different situations, and they talked about how caring you were and attentive and patient, and how you educated them on all things for their bodies, whatever they were going through. You really took the time out and you spent time with them.
Yeah.
30, 45 minutes, time. And I got those stories, 2 different people, 2 different times. So I know that's definitely your brand,
Yes.
that you're patient-centered, driven by a mission to bridge the gap between conventional healthcare and modern wellness practices. Her work empowers individuals to take control of their health in a more inclusive, informed, and holistic way. Kris, welcome to Crystal Clear Moments.
Thank you so much.
You're welcome.
That was
my
a
God.
wonderful introduction.
Well, that's you, girl. That is all you. I mean, I meet people sometimes, I meet a lot of people, but there's certain people I meet, I want to know. I want to get to know you. I want you in my friend group. And not that I have this exclusive friend group or anything,
right.
But it's just certain people, I think your energy vibes, your values vibe, your kindness. And, I think that, God puts people in your lives and says, okay, this is something you can develop. And
right.
Plus what you do personally is a passion of mine because I'm all about hormones, replacement therapy, and wellness has always been so important to me. And so I love that that's what you do and that's who you are. So thank you for accepting to show up here. So let's dig in, girl.
Yes.
Yes. I want, let's find out about Kris and what she does. So first, before we kick off, explain to people what is a nurse practitioner and what's the difference between a nurse practitioner and a doctor, an MD.
Sure. So as a family nurse practitioner, we are have an advanced degree, sometimes multiple advanced degrees. I have two, one as a master's in nursing education and then a postmaster's as a advanced family nurse practitioner. But basically, we are doing a lot of the same types of activities that a doctor does in the evaluation, treatment, prescribing of medications to take care of the patient and address whatever symptom or illness or concern that that patient might have. So we basically, once we get to that RN degree, we get licensed as registered nurses. We're using a lot of that bedside knowledge that we've gained, and also the knowledge that we gained in nursing school. Nursing school is rigorous. It is medically centered on disease, condition, symptom management, all of that stuff. And as registered nurses, we're applying that at the bedside, and usually we're then taking that and reporting it to a doctor for for them to then prescribe medications or give us an order list of things that we should do to care for that patient. So essentially we take that knowledge as advanced practice nurses and we bottled it up, learned more about how to do that in those graduate programs. And then we're now doing it ourselves and supporting the doctors and clinical teams in providing that care to the patient, either as individual practitioners, which I am, or in collaboration with other doctors and other providers.
Yeah, well, I find interesting, when you and I were talking about the difference is that, from what I'm hearing you saying, is that you're learning while doing.
Yes.
And you're diagnosing, so you're testing. You're constantly testing what you've learned.
Yeah.
And then you have, of course, the physician there is maybe to coach, or you oftentimes are probably coaching them as a partner. But it's like you're on the job doing the work.
Yeah.
Not classroom instructor, more in the actual workplace, in the actual hospital, patient by patient by patient.
Yes, I vividly remember one instance where it was like a light bulb for me. I was working as a triage nurse in an internal medicine clinic, and wonderful medical team, two doctors that I were working for. They were both internists, and I'd been working there for about a year or so at that point. And I was triaging a patient, and I was giving the doctor the report and saying, she has, onset of these symptoms, rash, redness. I believe it's an infection. What would you like to prescribe her? And he looked at me right in the eye and he said, what do you think she needs me to prescribe for her? And I took a breath for a second because I was just like, wait, what?
He's asking me.
He's asking me. And so I, told him what I would prescribe for her, and he said, "Okay, send me the order, and I'll sign off on it. But go ahead and let her know that that's what I'll be sending to the pharmacy for her." And that for me was like my heart was beating fast, and just to be able to verbalize that back to him, that for me was like it was a proud moment for me, and it was like, oh, I could do this too, like for him to have the confidence in me up to that point. It was like, wow, like, okay.
Yeah. That was your crystal clear moment,
that
right?
Was
in that moment,
yeah.
That was your crystal clear moment. So talk to me about confidence. Where does confidence play in all of that?
For me, especially as a nurse to an advanced nurse practitioner, it is a lot of the confidence I've gained over time is from my patient interactions. The benefit I think sometimes we have as nurses is we're directly interacting with that patient. We see them at their worst, so they come in, they're sick, they're ill, they've got all these different symptoms. We initiate that treatment plan, and then we can watch them get better. So we understand how well that treatment plan is working for them, or if it's not working for them. So even as an individual provider now, my confidence has come in that trial and error of initiating that treatment plan, following through with that patient, and then seeing if they get better. And then if they're not getting better, it's like, okay, well, let's move on to, plan B and go on from there. And so I've been able to build my understanding of what's going to work the best and the fastest for the patient, and then get them back to wellness much sooner or quicker. So that's been my way of feeling more at peace with the decisions and treatment plan that I'm initiating for my patients. And that honestly has been what has empowered me more in the hormone space, because there's so much that is misunderstood about how to treat patients who are having hormone imbalance. So you have to just learn that in clinical practice, and then just trial and error it, take baby steps. And then as the patient feedback is coming back, then it's like, okay, yeah, that worked. Let me move on to the next thing, or let me build on this, because I know we can do this a little bit better. So that's
the confidence is just building every time.
Yeah.
So it's two things I want to ask you. First, define wellness. Like what is wellness? And the other one is, what would you say, maybe one or two things that myths that people get wrong about hormones?
There's so many.
I know there's so many.
There really are.
But what's the one that like drives you crazy? Like, no, this is not right.
I have one there. A patient actually asked me yesterday. But wellness for me is an individual state of being. My individual being is going to be different from your individual state of being. And so I need to understand what that is for you. What is your ideal perfect day? And then work to help you achieve that, whether it's with that symptom resolution, that disease management, helping you with that stress reduction, whatever it is, helping you understand what you need to do in addition to that medication, that supplement, that vitamin that we need to implement for you, and then help you work towards that. So that's kind of why a lot of my medical visits take so long, because it's not just a singular approach for that treatment plan. I want to help you focus on getting to that individual state of being, that wellness that you desire, because that's what is, I feel, sometimes missing in that medical communication. People don't understand how to get there.
Absolutely.
And as an objective viewer, I can give you the treatment plan. I can give you the tools and the resources and recommendations to encourage you to get there. Because sometimes people know how to do it, but they need the encouragement. Or sometimes fear is in the way, and they need to understand how to work through that fear. So that's where I feel a bit even more empowered to make sure that I work with them on all aspects of achieving that wellness balance, because that ultimately lends back to them managing that symptom, managing that disease, and being even compliant in their overall treatment plan that I initiate for them.
And I think it's interesting because we hear wellness all the time, but we don't understand that it's different for all of us. And I love that you have them share what wellness looks like for them, and then kind of work from that space, so that they can get to their wellness. Have you ever had a patient who just did not know what wellness felt like, or just have been so ill for so long that you had to define it for them or help them define it?
And even to go back and answer your question about hormone, because I know that that's often a question that comes up, and it's a concern oftentimes, and even that fear point that prevents people from wanting to even get hormone therapy and have that symptom relief. It's that concern for cancer. It's that concern for, it causing harm or damage to their body. And when hormone therapy is initiated appropriately and correctly for that individual, it's going to provide balance. It's going to provide stability. It's going to provide support. So that for me, especially having done it for many years, I know that we can achieve that without causing that risk, or even making sure that we're keeping that risk at its lowest. And so I can confidently, and communicate that to my patients and make sure that they understand that, because it's one that is a hard stop for many of them, and they will suffer in their symptoms
and suffer.
Oh gosh,
it's suffering. I've seen women just suffer, and they'll say, well, my mom did it and she made it through, or we're talking and they're perspiring just, I mean, they're wet, in the middle of the day, just sitting there, maybe drinking some tea or something. So
and it's almost, well, and even to that point, just to add, it's almost like, well, if my mom had to endure it, I have to endure it too. Or if my sister had to endure it, I have to endure it too. So it's almost like this community, this badge, like, well, I guess I'm in menopause, I have these symptoms, and I just have to kind of suffer through it. And you never have to suffer through menopausal symptoms, especially in whatever, frequency or severity. There is tools and resources to reduce that symptom, get you to quality of life that is allowing you to get to that state of being, whatever means that is for you. But for me, that is so important, and even more so why I do spend that additional time, just making sure that I get that education in them, get them to understand, because I know that once they leave my office, they're going to be back out in the world, misinformation or information.
And it's everywhere.
Right. And they're going to be like, hey, what are you doing? Oh, yeah, I got started on, HRT.
Yeah.
Oh, that's bad for
you.
Oh,
my God. Oh, yes.
You shouldn't be doing that.
Yes.
Right. But then in that education that I've provided them, they can say, no, Kris and I, we've talked about it. She's got this plan. She's monitoring me this way. She's doing these things to make sure that those risks aren't going to be increased for me. So that is important for me, because then I know that if they didn't get that education, they're going to just stop. They're going to
get fearful again.
Yeah, they're fearful again. Right.
So I want to hang here for a while for a couple of reasons. I like to talk about what age should women start thinking about HRT, hormone replacement therapy, and when should the conversations begin with our young women? Because I think back, I think back in my 40s, I can remember the change, and I can remember not liking it and saying to myself, well, I don't want this to be my normal, and going to my doctor and saying, I don't like this. What can we do about it? And being very firm about it, and willing to hear what they had to say, and knowing that I didn't have to suffer. I didn't know what was available to me. I just knew communicate what you don't like.
Yes.
And from there came me learning about HRT.
Right.
Before that I was like, I don't like hot flashes, and fix it.
Right.
And I don't like that. I don't want to be tough like my mom.
Right.
I'm not that girl. I don't want that. I want to sleep at night. I was just like all of my I don't likes. So how young should we start having this conversation? Because I think, especially in Black culture, we either don't want to do it or we think you have to be 50.
Yeah.
And I don't think that's right. So you help us, Kris, understand that.
Yes. So my answer is a little unique, because I'll just say for women, the time to start evaluating for hormone imbalance, or even just getting that risk understanding of what that could be for you for hormone imbalance, I say start in your early 30s. So 30 to 35. For some, that might be 25 to 30. And I base that on what your family history is, because family history does play a role in essentially when hormone imbalance can begin for you. So if we're just looking strictly at when perimenopause can happen, when menopause can happen, around 33 to 35 is when some women can start to experience imbalances in hormones.
Define perimenopause so people understand what that is. So
perimenopause is that state right before menopause where you can start to have irregularities in your hormones. Yeah. So, and some of it can be stress induced. Some of it can be related to just your hormones, just kind of there's a little hiccup in there, that happens where they just don't want to behave that month. So you might, skip a day or 2 days, or it might be a little bit heavier that month. You might have more cramping that month. You might be more moody that month. You might be more fatigued that month. But the next month, you're fine. The month after that, you're fine. That can be those early signs of perimenopause. I remember
those. That's crazy.
And it's like,
times.
maybe it's and you explain it away, like, I must have just been really stressed.
You do. Work is busy, or my
family's
kids.
busy. I must have just been, had a really, difficult time.
Right.
But that can be the early indication that perimenopause is happening for you.
Right. And what I find during that time too, that's when we're powering through our career.
Yes.
That's when we're raising our kids. So that's already just a stressful time, just hormones removed.
Yes.
So
usually women have kids under under 10. So again, you can explain it away and say, well, Billy was up late, so I just must have been really tired, or, whatever it is. And so you often don't recognize that I need to actually be paying a bit more attention to myself internally and figure out, if that's something that I need to start addressing early on, or, just kind of keep an eye out for if it continues to happen.
And for a person to identify if they're at a hormone imbalance, they would need to do like a blood test, or?
There's lots of different things to do. And again, if we're looking just strictly at, when perimenopause happens, when menopause likely happens, yes, you can go in, you can actually test your hormones. So there's a panel of hormones that you can check: your estradiol, your estrone, your estriol, your progesterone, your testosterone free and total, DHEA, your LH, your FSH, prolactin, So there's
you guys, we have a lot of hormones, okay?
There are a lot. So a lot of those that I listed off are some of their hormones, and some of the prolactin coming from your pituitary, that's a hormone. And then even I did mention your thyroid, so your TSH, T4, T3, free T4, all of those. So, and then others. So there's different hormones that you can look at to see, where you're at in that perimenopausal journey, and then even see for some, where they're at in that menopausal journey. If they're a little bit older and they're having more irregularities in their symptoms, then you can still, run a full panel of tests and see. It's a snapshot in time, but that snapshot can be very revealing, especially if you're doing a complete panel and you can see imbalances, or what I like to call subclinical levels that indicate that, there could be something going on. And so usually in that, there's going to be a follow-up. We're going to either repeat those labs in 6 weeks or whatever we need to do, or you're going to monitor your symptoms and then report back to me so that we can recheck. So we can try to then create that timeline of what's happening, not just with your symptoms, but with the values and the blood tests that we're seeing. And you can truly map out someone's journey that way. So coming in, and initiating that even in your early 30s can be very revealing. And oftentimes you can identify certain risk factors that you're essentially, you have a higher percentage for by doing that. And you can address that and keep it low. And that goes for certain types of cancers, certain types of growth, certain types of imbalances that can start to impact people. And this is like pituitary changes, adrenal changes, thyroid changes, just to name a few. So you can really start to address that early on and not wait till you're in a full-blown disease state to then address it. Because those early symptoms that you were experiencing was essentially your body trying to give you a clue that there was already dysfunction happening.
Hey, there's a problem.
Yeah.
So why has, and it's maybe happening, the medical community is not just when women are around 30s just doing the complete workup when you go to get your annual. So I go to get my annual every year, right? And they do an internal, and they do all the different, they do all the things, right? So how come that's not added to that as or is that something that's,
I don't know,
controversy, or is it asking too much?
I don't know. I know from my experience that when I was going through my graduate program for advanced practice nursing, I didn't get a lot of information about like menopause, about perimenopause. Literally, it was maybe a paragraph or like 5 to 10 minutes, 20
That's like
minutes
a big
even.
part of women's life.
Yeah. So like perimenopause, menopause, like we talked about, certain symptoms and things, but there wasn't a robust discussion about how to manage that for a patient in my program. And even when I talk to other nurses, nurse practitioners, even other doctors, they didn't have a lot of education either. We understand reproduction, we understand fertility and infertility, we understand, hormone from puberty to, reproduction, that we get plenty of education on, but not post babies,
Which is a lot of years.
Yes. And so even for me, just a short story, when I was going through my OB/GYN rotation, I was paired with a nurse practitioner that also was a hormone specialist. I went kicking and screaming because even then, again, it's like, why do I need to know about hormones? Like, like the first day, it's like she does mostly hormone therapy. Like I need my GYN. I need to count babies. I need to do pelvic exams. Like those are the things that I needed to get signed off on for my clinical rotation. So it's like I need those numbers. I need to be able to pass this part of my program. So I really did go kicking and screaming. And so that first week I was just kind of okay, what are we doing here? And she was telling me, and she had a full schedule of patients that she was seeing for hormone imbalance. And these were postpartum women. These were women, in their 50s and 60s. And she explained to me what she was doing. I would go in with her during those evaluations. I would even go and do my evaluation and then go in with her, and then we talk about it, the treatment plan and everything afterwards. And then after that first week, it's like, wow, okay, I'm starting to understand why this is helpful. And then during my rotation, some of those patients came back. So they came back in for their follow-up. So 4 weeks, 6 weeks later. Yes. And they're like, oh my God, I feel so much better. My husband is like, and some of the husbands would come in and they're like, thank you.
My wife was back. I think my husband said that about me.
This is life-changing. I forgot that this is how good I can feel. Because they forgot. They got lost in their symptoms. They got lost in just trying to, work with the symptoms they were experiencing and still get through their day, take care of their kids, run their household, go to work. And so they accepted that symptom as part of their daily activity of life, not realizing that up until that point there was something that could be done about it. And once they did, they recognized the benefit and the life change that they had as a result. And that for me was a light bulb. By the time I finished that rotation, I said, tell me what I need to do to become a hormone specialist. I said, I feel like this is what I want to do once I graduate. And literally, once I got my certification, I went and did my hormone therapy certification, and I got certified. And so I started seeing patients right away.
So I don't want to leave the men out, because it always feels like, and we talk about hormone replacement therapy, it feels so gender biased, like it's a woman thing. But men, they get HRT as well. So talk about how men, and I know I have men listeners, so tune in. This is not all about the girls, but really tap into it, because I think that our men are lagging. They need to catch up to how it can really enhance their lives. So talk to us about that.
For sure. And I think it's one of those things where it's not necessarily an exclusion, but it's an omission that's been there for the women. So being able to really put the emphasis on the needs of the woman when it comes to menopausal change, perimenopausal change, that has been missing and, again, omitted in a lot of medical clinics and practices. And so for me, that is a passion of mine. But you're right. For men, too, there is lots of benefit in bioidentical hormone therapy, not just giving, that pill for, intimacy.
The blue pill.
No, they don't have to just do that. There's a lot of benefit there, because they too will go through their version of menopause. It's called andropause. And for some men, that can happen in their 50s. It can happen in their 40s. Some men may also experience it in their 30s. There are other there are underlying conditions like certain types of anemia, certain types of thyroid changes and things like that that can cause a man's testosterone to decline or be impacted. And so they will start to have mood changes, weight gain, fatigue, all of those similar types of symptoms that a woman will go through during that perimenopause to menopause transition. They will go through it as well in that andropause state. So it's important for them to come in and get their testosterone levels checked, their free and total, their thyroid, their prostate, their prolactin, their estrogen. Men have estrogen.
Men, you have estrogen.
So we need to check all of that as well and see where their levels are. For them, especially if they're symptomatic or maybe asymptomatic, and you can see that subclinical value in their testosterone, then there is treatment. We can initiate that testosterone therapy, or we can initiate something to support the stabilization of their testosterone, give them tools and resources to increase it and also keep their estrogen levels low. Because often for men, there can either be just a decline in the testosterone or an increase in their estrogen, and that essentially counterbalances the testosterone for them. So we have to look at all of those values and make sure that if we're increasing the testosterone, then we keep that estrogen low. So that way that keeps their risk factors low, and also allows for that testosterone to go into the muscle and the tissue and the cells, and not just also be this free circulating testosterone that isn't providing benefit to the body. So there's a whole process even for men to have hormone replacement, and they need to go through that too. It's not just enough to, say here, take this testosterone injection, because even injections may not be the appropriate route for them. There's other ways to do that to stabilize their testosterone.
I love how you customize it. Everyone's uniquely different.
Yes.
So what does weight have to do with this? Is there, if you're struggling with weight, or maybe you inherited and your family has an issue with weight, can that put you into a hormone space earlier, or can you reduce weight or do some weight loss to reset that? Because I know there's a lot of conversation about how weight and how losing weight can impact so much in terms of your wellness, right?
Absolutely.
So how does it impact in the hormone space for men and women?
Absolutely. So when it comes to difficulty losing weight, or specifically abdominal obesity, where you have that weight that's just centered right around your abdomen, you can have skinny arms, skinny legs, but your belly you can't get rid of it. That is someone that is in a clinical state of hormone imbalance. Usually it's related to insulin resistance, their cortisol level. It could be also related to what I like to call estrogen dominance, which is a real thing. So there's several different types of hormone imbalances that can be occurring for the individual. So and as a result, that is what's causing them to be in a state of clinical hormone imbalance that we have to address. It's not always enough to just say, here, take Ozempic, take Wegovy, take Mounjaro, and address that, because it may address one aspect of it for that patient, but it doesn't actually address the other hormone imbalances that may occur. Or for that individual, if say they take that route, it's going to take them maybe twice as long to get to that end result than it would for someone who didn't have that issue. So that is even part of making sure that someone who starts a medication like that for weight management understands that for themselves, so they're not coming back and saying, hey, I didn't lose 10 pounds this month. What's going on? And, unfortunately, I have to say, well, you're not going to, because the way your hormone imbalance is for you, you're going to maybe lose 3 pounds on average, maybe 5 pounds on average. Or right now, you're not going to see any weight loss at all, because your body needs to get out of that negative state of that hormone imbalance until until it does, then you're not going to see that weight loss yet, but give it time, so let's wait that 6 months.
I bet they hate that.
It's hard. Those are hard conversations.
I bet, because I think the media, and then people that you see, who hasn't seen someone or who's all of a sudden's lost 50 pounds, and it feels like it a week.
Right.
You know, and it could have been 6 months or a year, but it seems like it.
Yeah.
And I think
some
people think
do.
it happens.
They lose really quickly.
Really
and
fast.
sometimes it could be depending on how that medication was prescribed to them. I don't allow for my patients to rapidly lose weight on that medication. So often, even when we're initiating a medication like that, we're monitoring very closely. I will delay transitioning up or titrating that dose so that we can slow down that weight loss, because ultimately that has just as much of a negative impact on the body as the hormone imbalance that we're trying to manage, or even just the weight issue that might be occurring for that patient. So losing weight rapidly can cause significant health changes, and we don't want that. So allowing them to lose a steady weight loss, you know, for them, whatever we find is the perfect average for them, then that's what we try to strive for, never in excess, but trying to keep them within a safe range so that once they get to their goal, there's not going to be a lot of loose skin, a lot of health changes, cardiovascular issues, thyroid issues, like all of those things that then we have to suddenly now treat or manage or prescribe medications for because of the effect it's had on their body.
Wow, that I didn't even think about all the other factors. I mean, you lose the weight, but then there's other things that can pop up if it's not, like you said, monitored and managed, and then too, the patient understands, like you said, some conversations are it's going to take you a little longer, and some is like, okay, you're moving really fast, and slow you down.
Absolutely, absolutely, that's so necessary. And even just kind of back to, you know, the concern for that abdominal weight. Once we identify what that other underlying imbalance for you, maybe it's your thyroid, we've got to stabilize that thyroid function. Maybe it's your adrenals, we have to stabilize your adrenal function. Maybe it is that insulin resistance. Well, now we need to really work to support that as we're putting you on that GLP-1 medication, so that way that your body is able to have that balance in your pancreatic function and that weight loss that we like to obviously see eventually. Because some people, they can be insulin resistant, but they're not diabetic. You know, those are patients that will often struggle in the beginning with that weight loss because of the fact that their pancreas isn't really working for it. It's under stress. It's under significant stress. So we have to stabilize that.
Wow, that's so. All of this makes sense. I don't think that because information just coming at us, we don't sit down and really learn like what you're sharing with us. So I hope if anyone is listening, and if any of this feels like, oh, that's me, or I'm interested, really find someone like Kris who knows what they're doing. Like, they are certified, they understand hormones, they're speaking to you respectfully and educating you, and they're meeting you where you're at, because that's so important.
I agree.
When you're dealing with it. I mean, I'm really careful about my partners. I call them partners, my healthcare professionals who work with me, and we're friends. We're talking. I talk to them about what's going on in my life and what's coming up, but anything that's making me not Crystal, you know, whatever is going on in my life. So we do a quick little, how are you doing? But I think that's important because I've done that before, and they really were able to like talk to me or really help me with something else, just knowing where I'm at.
Right.
Like, you know, oh, your parents are aging. How is that working for you? So what are you doing with that? So all those types of things. So I think it's important.
Right. That conversation with the patient, just being able to, in that relaxed state, kind of share what they're going through, what they're experiencing, what's happened in their life and how they're dealing with it. It is so revealing.
Yes.
I learn more in just saying, hey, how's it been going since I last saw you? And then they just kind of word vomit everything. Yeah. And it's like,
so a little therapy is going on, right?
It is. But in that, I can understand, you know, what you need and support. Or, hey, I heard you say that, you know, or you were having this symptom. Can you elaborate on that for me? You know, or it sounded like, you know, there's an imbalance that's happening. Let's dig into that a little bit. Because in that, I can actually understand for a lot of women, especially in that first medical visit, I can understand the type of hormone imbalance they have and the degree of severity. And so that allows me to figure out what that evaluation is going to look like for them. Is it going to be kind of like, well, let's just run these basic tests first and just kind of see, or no, ma'am, we're going to need to be very aggressive in evaluating these symptoms for you because I'm concerned about some significant changes that might be occurring. And so that might be a more robust evaluation that we have to do. And so I can understand a lot of that and even kind of guide the conversation as they're just sharing in conversation what they're going through. And so that for me is very helpful, and I know it's relieving for the patients.
Oh yeah.
So that's actually part of the treatment that I enjoy the most. I kind of feel a little bit like Sherlock Holmes,
like investigating, like looking for like the mystery. I could see that. I could see how just trying to hunt down like the root cause and why is this happening, and that's good. That's good how your approach to it is like a mystery, and you want to solve the mystery. So let's switch gears and talk about innovation, because I really want to hear about the different tools that you've created. You have the one, is it the one about the skincare?
Yes.
And that one is called?
Andy.
So let's talk about Andy first.
So Andy was born out of, so we have our Pink Life Med Spa at our clinic. So we do our aesthetic treatments and everything on that side. I'm big on taking that medical approach to your skincare and helping you understand, what's going on with your skin, what you need for your skin care, what products, what frequency you need to return to the clinic. But again, same thing, I can provide all that information in that visit with them, but I know once they leave, they're going to probably forget some things, or they're going to have some follow-up questions, or they're going to need some guidance, just as they're going about trying to make those decisions about skincare, or maybe they're watching a TikTok or an Instagram video, and they see something.
Oh boy, this serum does this.
Right.
Yeah.
And so Andy is kind of just like, she is a virtual esthetician. So you can type in your question like, hey, I see this serum, tell me, is this something that could be useful for me? I have combination skin and I have, issues with hyperpigmentation. And Andy, she can actually give you input on whether or not that would be a good product for you. And the way I created Andy was I basically took a lot of my research and data and just kind of plugged it in, gave a lot of skin analysis and skincare products and things like that, just as that background data for her. So essentially, it's almost as if you're kind of talking to me in the clinic, but you're talking through my virtual esthetician.
Oh, so like your face shows up? Is it like that?
No, I haven't gotten that advanced yet, but it's like a chat interface.
Okay.
So you can have it on your phone and you just kind of...
Oh, that's good enough, though. You can still get to it.
Yeah, so you can just, text your question. You can, it can help you with your skincare routine. If you're looking for a specific product, if I'm saying stay away from these products, then you can type in that product and say, hey, is this product good for me? Then, it'll tell you if it is or if it isn't, because that's the other thing that is so important to me. There's a ton of skincare products out there on the market. It is hard for me sometimes, even just trying to see what to choose, what to get, and if it's hard for me sometimes, I can only imagine how it is for someone.
Overwhelming.
It is. Yes, and so Andy's role is just to try to help just, give some clarity in that, I think. So she can give you some guidance and some recommendations based off of my input. I am a lover of over-the-counter skincare. I think that skincare should be affordable. There isn't any one product. Yeah, there isn't any one product that should cost you an arm and a leg to get.
Agree.
Because there's so many different natural and very clean products that you can get on the market that will benefit your skin, regardless of your skin issue or concern, whether it's hyperpigmentation, combination skin, rosacea, melasma, whatever it is. There's a lot of different products over the counter that will help you, and they're costing $10, $20, maybe $30 per product. So in total, if you get a cleanser, a toner, a serum, and a moisturizer, you should be under $100 for that. You know what I mean?
That's so good to hear, because moisturizers. No, how about this? A serum can be $250.
That's crazy to me.
That to me is, and
crazy to me.
I think some of us, not all, think that the more expensive, the better quality.
Right. No, you're paying for the brand, and there's nothing wrong with that. You know, you're a company, you have to make money, but that product isn't going to. You can find a dollar store product that does just as good or provides similar benefit, because a lot of it is still the application of it. You still have to do it in the right step. You still have to make sure your skin is prepped for that product that you're going to put on. You can't just slap it on your face and expect it to work miracles. If it's a $200, $300 skincare product, you still have to follow this routine. I had a client come in, and we did, it's called Skin 5 that I do, where we do that evaluation of your skincare products, your routine, your skin concerns, and then we come up with that plan that's going to work for you. She had this very expensive line that she'd been using for years, and I asked her, after she told me what her routine was, I said, so how does your skin feel after you use all those products? And she says, well, it kind of feels a bit dry, and I notice that I'm a bit more oily when I use it. And so I said, so why are you still using it? So it's kind of like an aha moment. It's like when just even saying that, it's like, you know what? I didn't even realize.
Almost stuck in the routine.
That was her routine that she'd been using, and she thought because it's an expensive line, it's got such a great name that was the product that she should be using. I was able to transition her over to something she could find at Walgreens or CVS that was more hydrating, more balancing to what her skin needed, and she's loving life. She's putting that money towards something else.
Absolutely.
So
and I love
that
you actually you say that, because we spend I think it's billions of dollars in the industry, and women will spend money on hair care and face products, either to be cleansing or makeup, and other things we may even, and for some women, they may put important things aside.
Right.
Instead of investing in, product that's just as good, but not as expensive. So I'm glad you promote that with your patients. And I've heard that you did that too. So these are things that I've, people that I know that go to you that are like, she's not trying to rip you off. She's just trying to, your passion is really wellness for hormones and people living their best life and great skincare, and these are things, body weight, all these things are important, but I think sometimes we feel like it's too far away.
I agree.
Like there's a cost, or I don't know where to go. So as we wrap up, please share with us, if someone was interested and wanted to get to you, how can they find you?
Very easily. So they can either go to krisadair.com, adairclinic.com, or pinklifemedspa.com. So those are my websites that are virtual, they're accessible, that people can have access to. And each one will direct you to a number or a way to either email or text the office number, so that way you can have access. I do virtual visits, so
Very nice.
Virtual consultations. I do inpatient visits. So I try to make myself available so that way I can see as many people as possible, help educate, provide resource, support, advocacy, whatever they need. I try my best to really be available for that.
Good. Thank you. Thank you so much. And I've been on your website, and it's super easy to use and navigate. So
there's
people,
a chat
please
interface
pop
too.
on there.
So it's super. You can even just ask questions with the chat interface. So that way it's, again, you can already get an idea of what to expect before you come into the clinic, and then even schedule appointments right there too.
Love it, love it. Well, thank you for being my guest. This was wonderful. We've got to do another one, because there's so many other areas I think we need to touch. I think that people need to know about what you do and where they can find you. So thank you so much. And
My
everyone,
pleasure.
please go on to Crystal Clear Moments Moments, YouTube. See all of my episodes. I think I just topped over 50, so go check them out. I'm super excited by that. That's a milestone. And also, if you have any questions, you can contact me at crystal@crystalblackwell.com. Thank you. Appreciate you. Bye-bye.